Just to introduce myself, if you don't know me, my name's Caitlin. I'm the operations manager here at Norfolk. I am going to hand over to the Department of Health and Social Care. So we've got Anna Waters and Claire Lucas with us today from the Fair Pay Agreements team. So they're going to be giving us a bit of a presentation on the Fair Pay Agreement, and then there'll be some time at the end for a Q&A.
Thank you so much, Caitlin, and thanks for having us here today. Just to introduce myself before we kick off, so I'm Claire. I am the stakeholder engagement lead within the Fair Pay Agreement team, and I'm here today with my colleague Anna, who I'll just let her introduce herself too.
Hi everyone, thank you very much for having us. I'm Anna, I'm the Programme Manager on Fair Pay Agreements.
Perfect. Can we go to the next slide, please, Anna? Thank you. So this just gives an overview of what we're going to cover today. So I'm going to cover the first section, which gives a background to the Fair Pay Agreements policy. So what is a Fair Pay Agreement, why it is being introduced, when it will be introduced, and how it will be funded. And then Anna is going to talk us through our current consultation, which is live at the moment. So looking at why we're consulting, the content of the consultation, what else we're doing to engage the sector, and why your response is so important. We will, as Caitlin said, have time at the end for questions, so feel free to put them in the chat as we go or raise them at the end, and we will share these slides afterwards as well, so don't feel you've got to make lots of notes during the session. Next slide, please, Anna.
Sorry, momentary tech issue.
Don't worry, it happens.
Oop.
Fabulous, thank you. So what is a Fair Pay Agreement? So Fair Pay Agreement it's a new policy for adult social care. The intention is it will set minimum pay and other terms and conditions for workers in adult social care. What we're talking about today is specifically a Fair Pay Agreement in England. There are also plans to introduce Fair Pay Agreements in Scotland and Wales as well. Once introduced, a Fair Pay Agreement will be law, and it will be agreed through negotiations on an annual basis. The agreement is the first of its kind in the social care sector, but there is the intention to do this in future sectors as well. So adult social care is the sort of front runner for everything. The agreement will be reached through a process called collective bargaining. So we are going to set up a negotiating body that will bring together representatives for employers and workers to negotiate what the Fair Pay Agreement should look like, who could be involved, who would be covered by it. It's important to note that the Fair Pay Agreements will also be complemented by rights for trade unions to access workplaces. This is because trade unions will be involved in the negotiations, so it's to make sure that they are able to recruit and organise and be able to adequately represent workers, but it will be making sure that this is all done in a responsible manner. Next slide, please, Anna. Thank you. So, as you will be very aware, there have been many calls over the years for pay and terms and conditions in adult social care to be improved and to be negotiated between workers and employers. This is because we want to make sure that the sector gets the recognition and reward that it deserves. We have over 1.5 million people working in adult social care currently, who are providing essential care and support every day to people with a wide range of needs. But we're aware that there are significant workforce challenges in the sector with recruitment and retention, but also that adult social care is a historically low paid sector, with most workers paid at or just above the national living wage. So the intention behind the policy is to promote fairness, improve working conditions, and give workers much needed recognition and reward for the work they do. And the Fair Pay Agreement is part of the Employment Rights Bill, which has a number of other measures aimed at improving workers' rights. So you may be aware of some of the measures around statutory sick pay and 0 hours contracts. And Fair Pay Agreements are then another part of this, and starting in adult social care and then building out to other sectors. Can we go to the next slide, please, Anna? Thank you. So this looks at the timeline for this work. As this is a new policy and is coming into a complicated sector, it is a deliberately phased approach to introducing this. So we're currently in the first box. So by the end of 2025, we're going to be undertaking thorough sector engagement alongside our consultation. So that's why we're here today. And we're also expecting to achieve royal assent of the Employment Rights Bill. So that will be the next stage where it's gone through the parliamentary process and then we start working towards the secondary legislation. The consultation timeline, just to give some more detail on that. So we launched the consultation on the 30th of September. An easy read version has since been published as well. The consultation will run from September to January, although the easy read will actually close in March because it was delayed in being opened. In early 2026, the consultations will close and we will begin the analysis of the results that we've had, and then we will publish a response next year in 2026. So by autumn 2026, we will have finalised our policy design based on the outcomes of the consultation, and then we will establish secondary legislation. So this will be for the regulations that will go forward. By autumn 2027, we will have established the body that will be in charge of negotiations for a fair pay agreement, and the negotiating process will have begun and concluded. And the government would therefore have the agreement that has been put forward by the negotiating body. And then by April 2028, this is when we would hope to ratify the first FPA, and this would mean that it would come into effect and be applied to workers' contracts. So as I say, it's deliberately phased within this, partly because of the Employment Rights Bill and the legislation process that we're having to go through, but also allowing plenty of time for negotiations to happen. So the intention is there would be at least 6 months for those negotiations to happen, and then a further 6 months afterwards for starting to prepare the sector for implementation and introducing the FPA. Next slide, please, Anna. Thank you. So in terms of how the FPA will be funded, as the majority of adult social care provision is funded by the state through councils and the NHS, the government will financially contribute to the FPA. So in the 2025 spending review earlier this year, there was an increase of over £4 billion announced, and this is funding available for adult social care in 2028-2029 compared to 2025-2026. As part of that £4 billion, £500 million has been earmarked for improving pay, terms and conditions and other matters as part of the first FPA. And it's important to note there that that 500 million is for that first FPA in that first year. So the intention is that there would hopefully be future funding for future years when other FPAs are negotiated. And this additional government funding will be paid to councils to reflect the increased cost of care. To balance the need, though, for greater pay for the workforce and the potential cost to taxpayers, we've proposed that the negotiating body will be given a cost envelope at the start of negotiations. So this is essentially to set out the maximum funding available to councils to cover the increased costs resulting from the fair pay agreement. So the negotiating body will have to negotiate an outcome for the fair pay agreement that is affordable within the envelope. And this is something that has been requested by the partners we've been speaking to over the last year, because they were very aware that if they didn't have an idea of what funding would be available, they may put forward an agreement that couldn't be funded, and that could delay the whole process. So the intention is that they know what money they have to work with and therefore can make decisions based on that. Excellent. I will pass over to Anna now to talk through the consultation.
Thanks, Claire. So we also wanted to just say a little bit about the consultation that's open at the moment and what it includes and who we're looking to hear from. The important thing to note about the consultation is that it's a consultation on the process of reaching a fair pay agreement. It's not a consultation on the outcome of what you would like to see or what you think should happen, who should get paid more, who should get their terms and conditions improved the first time around. What we're working on at the moment is the process and the the way the negotiations are set up, if you like, who's involved, how long they might take, that kind of thing. So we're casting the net wide. It's a public consultation available on gov.uk, specifically looking to hear from obviously anyone within the sector, and that covers all the boxes on the screen there, everyone from people working in adult social care, voluntary and community sectors, trade unions, commissioners. We want to hear from every part of the sector, because we want the process that we set up to be functional and to be to serve everyone within the sector, and to ultimately create something that everyone can get behind and work with. So the consultation kind of moves through the process of creating a fair pay agreement, of doing collaborative bargaining, and it covers things like the negotiating body, so who's involved in that, how that body is set up, what its sort of legal framework might look like, the process, including timelines, like I say, and the frequency of the negotiations that we might want to see. Coverage and remit is probably something that you'll be interested in terms of which roles might fall under the fair pay agreement and which might not. So the way that the Employment Rights Bill is laid out at the moment is very broad, so it covers anyone who works mainly or wholly in adult social care, and obviously that is a broad, very broad range of roles. So we're looking for thoughts there on different parts of the sector that might be included or not included, especially in the first round of negotiations. And then we've got the sort of later parts of the process. So what happens if that negotiating body can't reach an agreement? How do we implement a fair pay agreement? How long would the sector need for implementing something like that, and then looking at sort of compliance and enforcement. So lots of these areas have got proposals. We've worked for sort of the last 15-18 months on sort of designing some ideas for the process. So there's lots of these areas have got proposals to comment on or to choose between, and there's also lots of space in the consultation for putting your thoughts, lots of free text space if you've got thoughts and ideas, and we're particularly looking for things that you think we might not have considered or you think we might not have come across yet. So we're currently doing a wide range of engagement sessions with people like yourselves, dropping in on all kinds of meetings, conferences and events and things. We've done some sort of explainer videos which are out there. We can send you links to those if they're of interest about the consultation, and lots of setting up sort of roundtable discussions and speaking on panels, and as wide a variety of things as we can do to reach as many people as we can. Covered this a little bit already probably, but why your response is important is that you have a unique perspective. Every individual within the sector has a unique perspective on how this might work from your position. So important that we hear from as many people as we possibly can. There's various things you can do to help us. Obviously engage with the consultation itself. You can spread the word and share information for us if you think there's colleagues or people in your networks that we haven't reached, that we haven't spread the message to. Let them know this is happening, and to respond via the consultation. Our diary is booking up now pretty much, but if there is a particular meeting or particular group of people you think we haven't spoken to that we really ought to contact, then we might still be able to fit a session in with them if you want to let us know about that. And there's our email on the bottom of the slides here as well, and the slides will be circulated, so you've got that if you need to get in touch with us or have any problems responding to the consultation.